Hi, so my article was called HIPAA Clinical and Ethical Considerations for Nurses. It was published in the Orthopedic Nursing Journal and written by J.A. Erlin. So the article starts with just writing about how nurses are required to uphold HIPAA and ensure that patient rights are being upheld and being cognizant of the risks that are present today, especially with a lot of the electronic medical records, and making sure that no one's imparting any behavior that would jeopardize anyone's health information. So it goes on to discuss the history of HIPAA and the privacy rule and what that act actually states. So it's basically just the standards that help specify when and where that health information can be disclosed and assures that the patients are in control of this so they get to decide whether or not their health information is being accessed by different providers, but it does encourage that there is communication within the healthcare system so everything can be integrated across the border. And the article really stresses that the role of the nurse is to make sure that the culture of privacy is remained in any healthcare setting and that no information is being accessed by anyone who's not supposed to be accessing it. So making sure you are logging out of your records, making sure no computer screens are being turned that any visitors could see, making sure you shred any handwritten notes, not talking at lunch or anywhere else public about any patients, and making sure that any staff, especially volunteer services, that are aware that they have to protect any information that is confidential. Because I know in one of my clinicals, a patient's visitor actually tried to go behind the nurse's station to talk to something about the patient with the nurse, and the nurse did a really good job of having her leave the nurse's station and explain to her that there's a lot of patient information back there and she wasn't allowed to. And the visitor seemed to be fine with that and understood pretty well. So it also discusses that the role of the nurse is to make sure there's still trust between patients and the healthcare system, and having to explain any HIPAA and privacy rules to them as well, because many people sign documents but they don't actually know their rights. So as a patient advocate, nurses need to be explaining and answering any questions that anyone has. So the article is clearly intended for nurses, especially ones who are in technologically advanced settings that have electronic medical records. But it also does indicate that, especially with filing cabinets, that everything's still locked in place. And it's just basically a really good refresher on what is and what isn't appropriate with healthcare information, because I know that can be not as discussed lately, or it's not the most important thing. So the conclusion of this article is that the job of the nurse is not only to provide care, but to understand the HIPAA rules and the privacy rule, and making sure that that's being incorporated into patient teaching or any family when it's necessary. And it highlights what the consequences are. It also highlights that there are consequences to those who do not comply. But I think one of the limitations of this article was that there's no data that will support how many nurses do follow all HIPAA rules, or and also doesn't really talk about what the consequences will be specifically. And just some of the data it would be good to have some of the data to support all this and to enforce some of the calls to action. And yeah, that's about it. I think this is a great starting point for anyone who wants to write about the role of nurses in relation to HIPAA, and making sure and finding ways to identify any further education on the topic, and maybe as a starting point for any teaching plans for any students or nurses who are still learning. But yeah, that's about it. Thank you.